All right, good morning. It is our Harlem Emergency Network live weekly update on COVID-19. Bob Ponce here with Carol Johnson. Carol, how are you doing this morning?
I'm doing great, Bob. In
Hmm.
spite of all of this heat, I'm holding up.
That's good. That's good. Stay hydrated. I'm staying hydrated. I've got my juice right here. I'm going to be sipping during the course
Yeah.
of our broadcast. Today we're going to talk about data. We're going to get into the numbers, and we brought on a guest, Mr. Clayton-Banks of Silicon Harlem, is joining us live this morning. And Clayton, how are you? Let's see. I see. Let's see. That's interesting. Let's try this again. I don't see him. That's never happened before. Uh, hmm. Well, that is hmm. Clayton, can you speak? Let's see if we can hear you. Clayton, can you say something? That's really odd. um. Okay, so I think he's going to have to dial back in. Let's get started, and as soon as he gets in, we will bring him back into the broadcast. So the data, the whole thing about COVID-19 and about dealing with pandemics in general is that the way that you conquer it is to really get a hold of the data about who's got it, where it's going on, how the testing is going on, and use that information to really determine how fast it's spreading, where it's spreading to, and what are the other factors involved in how people are either getting it and what are their outcomes. Um, but the problem we have and the question that we want to ask um, is the data trustworthy? Is it safe? And that's still a question that we have to really kind of dig in and dive deep in. So I'm going to show on screen an article that I came up with that was in Science Magazine, and let's take a quick look at it. So the heading of this article is Data Secrecy is Crippling Attempts to Slow COVID-19 Spread in U.S. Epidemiologists are warning on this. And so this is obviously a real problem when the scientists are not able to get the data. And interesting about this article is that it starts out talking about a state that we wouldn't necessarily have thought was a problem, which is California. Say California was a COVID-19 success story until suddenly it wasn't, and that epidemiologists from Stanford and University of California have tried to get detailed case and contact tracking data from state and county officials, but they can't get the information. And then to make matters even worse than that, they're telling the scientists that they have workload constraints and privacy concerns, and yet the other thing is that they're sharing the data with this federal contractor, Palantir Technologies, that we're going to talk about, because Palantir is a company that collects data for the government for a lot of different things. They use it for the criminal justice system. Supposedly, they use it to track terrorists, and it is an extreme privacy concern in terms of how they use data. And evidently, what's going on now, I think Clayton may be back. Let's see if we can get him in. All right. Okay, he's back. So Clayton,
Oh yeah.
good. So just to, we started out the conversation, and I'm going to bring you up to speed with what we were talking about. And what you see on the screen is that we're talking about an article that was in Science Magazine talking about data secrecy crippling attempts to slow COVID-19. And they start out talking about California, which is supposed to be one of the quote unquote good states. But epidemiologists from Stanford and University of California have been looking to try to get COVID-19 case and contact tracking data so that they can come up with more effective approaches to slowing the pandemic. But their requests have been refused. And at the same point in time, evidently, this data is being shared with Palantir Technologies, and and obviously we're also concerned with the latest move last week to now stop sending data to the CDC and now send it to the Department of Health and Human Services. And then when we dig deeper, we find that Palantir is now involved in the aggregation of information for HHS as well. So we wanted to really jump into this topic and definitely get your thoughts on one of the big questions that are on our mind, which is, can we trust the data? We know it's so important for COVID-19 in terms of tracking and stopping the spread. The data is important, but how much integrity is there in the data that's being collected on a state and local level?
Well, thank you for the question. And let me first of all say what a pleasure it is to be a part of Harlem Emergency Network. And if there's any definition around Harlem Emergency Network, it would be, in fact, the misuse or underrepresented area of data. Because what happens, what I have found in this era of time is that we're now utilizing data to determine outcomes for people. And if the
Mhm,
data is not properly not only accessed but analyzed and utilized, you could actually hurt communities. So I'm
mhm,
glad that the Harlem Emergency Network has taken this issue on.
mhm,
Nothing could be more important. Let me quickly just respond to your question, which is, of course, there's plenty of evidence now more than ever around COVID-19 and the pandemic that most countries, and now we're seeing that most states and cities are not um, providing the data properly for us to have a real set of information to make decisions. There's undercounting, there's not counting at all. There's a lot of data that's being held back, and what we're finding is that it's having an impact on the spread of this virus. So, to your point about, is this data going to be usable in the future? The short answer is possibly no. And that is a tragedy. One thing I will say, I think an important thing to for anyone listening is that data does not drive anything. A lot of people say, well, we're data driven and this data is going to drive whatever. Data doesn't drive. Data, as the great Peter Norton would say at a University of Virginia, that data is much more of a compass. So the aggregate of data allows us to make what? Human decisions. So we need to look at data as a resource, certainly, but not as the component that makes a decision. It still comes down to people like yourself and Carol that make decisions about our humankind. So, long answer to say, yeah, data is very suspicious in my mind on how it's being collected, how it's being analyzed, and how it's being deployed in the public. We have to be very careful not to only rely on that as a resource to determine what our actions should be when we are looking at health, when we're looking at education, when we're looking at workforce. All these things still need someone with reason that can say, here's the direction we need to go. And if I could say also, Bob, if I could just add that at the beginning of the pandemic, I made the case, along with others, I'm sure, that we had no data coming along sort of on a race basis, like, how many Mexicans were being affected, how many Black people were being affected. There was no data on that early on in March. And finally, some of the states have started to report that. We still have a few states in America that don't report that information.
Yeah, and I noticed another article also in Science magazine, and the title of this article is talking about the huge hole in COVID-19 testing data that makes it so hard to study racial disparities. And so this is obviously something that we're dealing with on a local, state, and national level. That the data around the collection of data around the outcomes based on race is really very, very spotty. And everybody is coming back and saying it's a hole in the research, and it obviously affects what we are seeing in terms of the outcomes that are hitting our communities so hard.
Well, that's just a fact. I'm sorry. Go ahead, Carol.
No, I'm saying that that was a great point that you raised, Clayton, because I know here at the community level in East Harlem, we always questioned how the data was being compiled. We found out that East Harlem was supposedly the hardest hit positive cases in all of Manhattan, but people weren't being tested. We didn't have testing sites. We still don't have testing sites. So we don't know how they accrued those numbers, who was tested, what races, because we're multicultural, and no one can seem to come up with any answers. So this was always frightening to us, and we're still asking the same question: how are you collecting this data? Because people are afraid to use public transportation. There was only one testing site here, so far away that the seniors and people with handicaps couldn't reach and were afraid to go into hospitals, which was one place that was open, taking 65 cases a day out of 115,000 people in East Harlem. So when they came up with these numbers, the first thing, it was frightening to me because I said they're making things up. And even now when we asked how it was collected, we have yet to get an answer.
And
Carol, I couldn't agree. Okay, go ahead, Bob.
No, go ahead, Clayton.
I was just going to mention, because East Harlem is one of those areas of New York that gets hit hard on these type of disasters. Hurricane Sandy, devastating to East Harlem, 9/11, and of course this pandemic. And I think your instincts are legitimate. The lack of trust of the city and of government in general has always been around for people of color in a lot of ways. So the pandemic not only exposes that, but further sort of justifies why there's so many folks that are suspicious. We have to work on that on both sides, because the more people that are tested, the more we're able to move this out of our city in terms of the virus. But I understand why people are, sort of suspect of things like contact tracing. What are you doing here? There's no demystifying that so far. That just sounds wrong. Now that you're going to hear more and more about plasma, where in our neighborhoods we call it blood. So it's like that's another thing that will people be somewhat turned off on. All necessary things, but if you don't work with the community and talk to the community, when I went over and built a resilient network in East Harlem, the very first thing I realized, I better know some Spanish, So it wasn't like I can come over there. I mean, and think about this pandemic. Most of it's been communicated in English. So how many of the people in that neighborhood may not have the right tools and information to protect themselves? These are all things that we have to take into consideration. And I know the city ultimately does, but your point is a good one. And that goes across the nation. There's plenty of communities like East Harlem that we have to take care of that are, one, have been mitigated in the past. So there's a lack of, how's this going to affect me? And two, governments need to become much more diligent about the data, about collecting information, and ensuring that everyone is getting the same access and exposure, especially to, as you point, is the health industry. I mean, so many of us are, if you look at a lot of people in the East Harlem area, and I've done a lot of these surveys, they are the service people of the city. They serve the city. So they haven't had a lot of breaks, be honest with you. They still are working in the hospitals. They still having to take transportation. They still, and these are the people that are getting sick. And there's something wrong with us when we don't address that, not only from a data point, but just from a human kind point. We've got to start to look at that across this nation. And most people work in service jobs. So there's been some oversight on that, in my opinion, and we need to make sure we have that data so we can protect our people and our friends and our neighbors.
Clayton, I want to talk about some of the data that we've been following throughout this crisis. And so there was two sets of data that we started to follow from early on. I would guess mid-March. One of it was the city has these public health milestones, which was basically the amount of hospitalizations, the amount of people in critical care, and the percentage of people who were testing positive. And early on, they came out with these milestones, and they didn't shout about it, but it was on their website, and then they basically said these are the benchmarks that we need to hit before we talk about opening back up. And so we are like, okay, fine, those are your benchmarks. This is something that we're going to watch on a regular basis, because if we see you doing something different from what you said you were going to do with this data, then we know we have a problem. The other piece of data that we were looking at on a regular basis were we were able to get zip code by zip code information about primarily I guess hospitalizations and deaths. And early on, we would get a daily map that would have color coded, and we were able to look at the map and see East Harlem was hot. We could see 16 zip codes in the Bronx, were hot, and we would at least have data that we could share on a community to community basis so that people listening to us could know, hey, check your zip code. You're kind of hot right now, and you really need to be paying attention to the information we're sharing in terms of taking care of yourself. Now, what happened was midway through May, they started not sharing the zip code by zip code data with no explanation. It just disappeared from the website. And they've still been sharing the public health milestones, but we've been asking the question, and one of the reasons we wanted to engage you into this process is to really kind of put our heads together to figure what are the tools we have to be able to check the integrity of the data that we're getting from our city and state officials, as well as to engage them in the process of giving us more useful data than what we're getting. Because as Carol has expressed, there's a lot of times that they say things out loud, and and when we do kind of our boots on the ground, and I want to brag about Carol, who has done a tremendous job in terms of not only monitoring testing sites, particularly in East Harlem, and going there and finding there's a lack of signage. Even a lot of the testing sites in East Harlem were like pop-up. They weren't even in the same place on a regular day. So how could you expect to get a volume of testing when people don't even know when and where the testing is going to be? So we want to really just kind of get your thoughts on how we can get more data accountability locally from our city and state officials.
Great question, and I'll look forward to you providing me the data that you have that proves Carol done such a good job. But
Okay.
we'll talk about that later. At any rate, it's just being funny, Carol. Don't think of it. I know you're a tremendous community activist. Let me quickly say though, this is not a COVID issue that you're talking about, Bob. This is something we need generally, right? So we know that for years and years and years, we haven't had the data to look at, how we solve certain problems, like whether it's housing issues, whether it's garbage issues, whether it's rats. We need to figure out how to solve a lot of problems in a lot of the neighborhoods of New York City and in other cities as well. And a lot of that can be solved if the community has the data. If the community has the data, they can then go, well, this is what we ought to do to solve this issue. So this is a civic issue in general, what you're talking about.
Mm-hmm.
My advice, my direction to your question is New York City has taken a big step in creating what they call the open data portal. And
Mm-hmm.
that open data portal is riddled with a variety of data sets from a
Mm-hmm.
variety of the agencies of New York City. They are now being required to open their data up to us, the citizens, since it's our data. We pay taxes in order to own that data.
Mm-hmm.
So I think what COVID should be, what we all should be fighting for is the data that's coming out of this COVID-19 should then be publicly available through the New York City Open Data Portal. That's
Mm-hmm.
the real solution here. And I'm on the Open Data Portal on the regular and looking at various ways that we can solve problems, particularly in Upper Manhattan, because
Mm-hmm.
it's really actually well done, particularly around 311.
Mm-hmm.
All the 311 calls are loaded in the Open Data Portal. So if you wanted to find out, for example, what's the noise like in my neighborhood,
Mm-hmm.
we've been hearing all the firecrackers and all the other stuff. You can literally go on the Open Data Portal and look at those trends and see what blocks and neighborhoods have those spikes. And you might find, I did one a few months ago, and I found out that there was all these calls about noise, and it turned out there was a particular apartment that their dog would just bark outside the window the whole night. So once you figure out what's going on, you can actually solve these issues. So that is one way to get at it, Bob, is let's utilize, and I don't think enough of us know about the open data portal,
Mm-hmm.
or in some cases about how to use it, but
Mm-hmm.
it's full of a lot of data, and we ought to press the city to make sure that the COVID data that's being generated is also in that data portal.
Now, I know the state also has an open data portal as well. Are those two entirely separate initiatives, or do they interconnect, or how do they stand in relation to each other?
My understanding is that the New York City Open Data Portal is only for New York City. It doesn't take into consideration Albany or Schenectady or any other city of the state. So I focus so much on the New York City Open Data Portal, and I've actually served on a commission that was dealing with communications of the city.
Mm-hmm.
And our focus has been New York City. So that portal is only recording, for example, as I mentioned, the 311 calls that are in New York City, not other cities. Other cities ought to do it themselves. You should do this on a city by city basis. It's much more
Mm-hmm.
efficient. I'm
Mm-hmm.
not sure how the state is putting their open data portal together that benefits me in Harlem, but I do know that every city at some point is going to want to have an open data portal for their citizens. It's just so much easier for the city themselves.
Mm-hmm.
Problems that they think they have to solve can literally be done by community activists like Harlem Emergency Network. I mean, you guys can take a data set out of there and go, oh, gee, maybe we need to ask the city to provide more garbage cans on these various blocks that have a serious problem with garbage. I mean, these just little things like that can make a difference in everyone's lives.
Mm-hmm. Okay. Do you think we could call upon you to perhaps at a later date give us a little tutorial on the New York City Open Data Portal?
100%. It only costs you $20,000 to have me do it, but I will absolutely do it.
Bob, write that check.
Yeah, I'm gonna write that check. We're gonna post-date it a little bit, but as
I will
soon as
be happy to do that. Not a problem. I think it's important to do. No question about it. I hope we can get a big audience for that. And
Mhm.
we have done it a few times already, as you know, Bob, in our office. We've had the data portal sort of lessons in our office. Of course, now we don't do physical things, but this
Right.
works very well on a StreamYard or a Zoom call, whatever. So yeah,
Mhm.
absolutely, we should do that.
Okay, good. Well, after this broadcast, we can put the calendars together and put that together, because I know for us it's important. And as you said, this is not just a COVID-19 issue. I think right now there is a lot of in the network of organizations who we connect with and partner with, there's a great concern about the rise of gun violence, and I think we obviously need to be able to know more about having access to the data, so we have more specifics about all the circumstances surrounding it, so that we can get to the heart of the issues. And we have a tremendous body of people who are working tirelessly to help move our communities forward. And we're trying to play our position as the role of sharing the proper information. And so this is really strikes to the heart of our mission right now. And certainly,
Well, let me, yeah, Bob, if you don't mind, because I know we're running out of time here. I want to tell you a sad thing, and then I want to end on a really happy thing. But
mhm,
sadly, the good news is we're taking on a lot of kids this summer and teaching them code, and it's been really. We started last week, and so we're in our second week. It's just been phenomenal.
mhm,
But two things I realized, which is so sad, that when 30% of the kids that are in the class did not have a computer, so they were trying to do the class on a cell phone. Learning how to code on a cell phone is absolutely not. You're not able to do it. So
mhm,
we have stepped up and we got with our partners and everything. We were able to get some devices, and so we've been providing every one of our students a computer so they can really get this done. But
mhm,
one of the things that happened was as we were putting the class together, we had three of the kids not join our orientation, and I was very concerned about that. And when we tracked them down and asked them why they weren't on the orientation, and you know what they said to me, Carol? They said, "We didn't have electricity." What? I mean, when's the last time you heard that from somebody? We didn't have electricity. Look, we didn't have electricity for a day and a half.
wow.
So what we're talking about here on Harlem Emergency Network has to go way beyond COVID. We've
Mhm,
got social determinants that are literally the kid, and luckily we were able to get a hold of these kids and get them in our class, because that might have been the difference of them carrying a gun or carrying a computer. I
Absolutely.
mean, that's really that dramatic. So I'm just sharing that story because I couldn't sleep for a couple of days after that. I couldn't believe that somebody could not. I mean, I know people that paid their bill in 4 or 5 months and had still have electricity.
Right.
So it wasn't a deal of billing. It was the fact that the building went down. They lived in public housing and the building went down. So we've got a lot of ways to go to make this much more equitable for everyone. The high note is I am predicting that Silicon Harlem and with your help and others, we are going to connect everyone, particularly
mhm.
in public housing, and make sure everyone has the internet. That is my commitment.
So I'm glad you brought that up, because the other topic that we wanted to ask you about, last week we were talking a lot about the issue of the challenge that parents have going back to school. There's still a lack of clarity, and it looks like they're still going to do some partial remote learning. So we wanted to talk to you about your experiences with how remote learning worked in the spring. And as we said, we knew that you were working to fill the gap of students who actually did not have the tablets. There was a lot of fanfare in the beginning about giving a tablet to every student, and we know the reality was way less than that. So we wanted to hear about your experiences in the spring, and then your thoughts on the upcoming fall coming up and how we address the same situation.
I don't want to be overly dramatic, but I do not believe that the spring was successful.
Hmm.
Once the schools were shut down and kids had to work from home, as much as the city tried to provide devices, there was so many of them that did not receive a device, and a tablet is not um, sufficient for some of the courses that these kids are going through. And so what we found is just about 50%, that's half the kids, just gave up, stopped trying to even work. So they have lost the second half of their schooling for that year almost entirely. So no matter how we thought remote learning would work, it didn't work because not only did they not have a device that was sufficient, but they also many of them didn't have the internet.
Right.
So what are they supposed to do? And so that's why you're seeing so much of the unrest that we're seeing is that they haven't had that one the social component of learning, but also they didn't have the infrastructure to even stay on top of the a lot of them didn't stay on top of the lessons and things of that nature. So to me, it's not been sufficient.
Mm-hmm.
And now and at one point in April they were sort of threatening the fact that there wouldn't be a summer youth employment program. So you
Mm-hmm.
go from not really being in school, now being told you may not be able to work, and all the summer camps might be closed down. You really start to have a whole nother way of thinking, So some of it we were able to recover. We opened up some of the camps, and we certainly have now some resources to support SYEP. But a
Mm-hmm.
lot of damage was done in that process. A lot of damage was done in April. I have to say that as someone who's very optimistic, but I have to say that that was a very tough time frame for a lot of people, April and May, and hopefully we're getting back online now. It's going to be very strange to see what happens in the fall. Are we going to really be back in school, or is it going to continue to be remote or semi-remote?
Mm-hmm.
Some of the young people are thinking they've just been on vacation since March 31st or so. So,
Mm-hmm.
we've got to get discipline back into our system, and it's going to take us and not someone else.
Mm-hmm. Mm-hmm. So, any thoughts on? I mean, I believe the plan is supposed to be about some partial remote learning, where 2 or 3 days a week are at home and the rest is at school. And are you seeing any more resources being brought to bear to bridge that gap, or are we still kind of at the same place we were in the spring?
Well, I'm clear yet on the resources that the city's going to provide for this fall.
Mm-hmm.
If it's like spring, it's going to be a problem. But I'm hoping that the infrastructure will be there for those kids, if you will, that aren't, don't have the sort of resources in the home. To your question about my prediction, if they look at the summer programs that are going on right now, particularly the one on Harlem, we are having a really good reaction from the young people. We are basically teaching three different cohorts:
Mm-hmm.
14 to 17, 18 to 20, and 21 to 24. So we see all the different phases of life in that particular curriculum. And we're
Mm-hmm.
teaching them how to code, but we also add a bunch of other things like how to work with each other, how to set goals, how to communicate, how to present. And
Mm-hmm.
so it keeps them interested. And I think
Mm-hmm.
at the end of the day, that's the most important thing you can do is make sure there's interest and there's an experience. And
Mm-hmm.
if the city and the schools and the DOE takes a look at what our program is doing, and they are, I think we can utilize a lot of that information for this fall to make it a little better for the students. At the end of the day, that's what we have to do.
Mm-hmm. So, I really want to thank you for taking the time to join us this morning. As I said, we definitely want to follow up with you and look into how we can learn more about the open data portal that the city has.
Hmm.
How can we effectively use that as a conduit to, have a community-based dashboard with the metrics and data that is really important to us, and also we definitely want to counsel with you on how we advocate to our elected officials and agencies about what we really need to get, and again, not limiting it to COVID-19, but I know you thought a lot about these issues, so we want to definitely marshal our resources together to talk about what we need to know and what we want to demand. As you said, we paid for this data, so we need to get it in a form that we can actually use and respond to it.
Exactly.
because that's where we
Well,
obviously.
let me quickly, and I'm sorry, Bob, but I'm just going to say one other thing. Harlem Emergency Network could put some real foot into is the census, because one thing we do know is that we can gain so much more resources in our community if we all can be counted. So I just wanted
Right.
to throw that out. I know Carol's on top of that, but I just want to make sure
We're already our
that we
next
are
guest.
all on top.
We've got Fareen Griffith coming on next week. She has been
Oh,
working.
Farine, yes, she's the
Yes.
czar. I hear
So
that.
Fareen actually was my
Tell her I
last.
said hello.
She was my last live guest on my WHCR radio show before the shutdown, and we had a long hour-long conversation. And she does a tremendous job about talking about the actual impact of it. And so, we're going to bring her back on and talk about it. It's basically filling out 10 questions for 10 minutes, and it has a 10-year impact, and this is what we need to do in
There you
2020.
go.
So, we're on the same wavelength.
Yeah. And if I could throw
All
out
right.
one more thought before we close, there's a great fear that when the children return to school, there's not a solid plan. Let's face it. We're talking about thousands and thousands of children across the country who have COVID, who have multi symptom syndrome, Kawasaki like COVID like illnesses, which affect children more gravely than adults. With adults, generally it's just the pulmonary system, the neurological system. But with these other syndromes that children are dealing with, is dealing with the cardiac system, the renal, the uh, kidneys, heart, blood, neurological, and there's something else in the above. But anyway, there's not really a solid plan to send these kids back to school. There's not a solid feeling that children will be protected.
Mm-hmm. Mm-hmm.
And that is the fear. My fear is that, and a lot of parents, I actually did an on-spot survey yesterday as I was giving out PPE. Every time a parent came up, was their fear of their children returning to the classroom setting.
Mm-hmm. Mm-hmm.
And if black and brown children are the ones that they're going to try to force into the classroom,
Mm-hmm. Mm-hmm.
and the more affluent children would remain on remote learning system.
Right. Exactly. So, and Carol, you've been really great as far as following a lot of the stories on this. And the overriding theme that I see out of all of the information that you've been sharing is that we're just starting to learn about the long-term effects of COVID-19. And, parents really need to not go under the illusion that that they have protection for their kids. Parents need to understand that this is a disease that can have long-term effects on your children, and if you're not protecting them adequately, and whether that's going to school, whether that's at home, whether it's about making sure they actually wear masks, making sure they social distance, and above all, boosting their immune systems, you might be creating an environment where your kids are going to have some long-term effects that we're not right now. We don't have enough information to tell you what it is, but we know enough to know that it's more than we thought about it. And the whole idea that kids are immune, we need to throw that out the window. Kids have died from this.
Well,
So.
the interesting thing is that, the studies show now that everyone who has been infected with COVID and have recovered have major pulmonary problems that will be lifelong. So when you consider the fact that you've got close to 10,000 babies under the age of 1 in Florida alone who have COVID, you've got the beginning of another sort of pandemic, if you will. Because these children at 1 year old or younger, these children are going to have major pulmonary, heart, and renal problems. They're not even going to be given a chance to live. And they're talking about this in other states, but I'm not really hearing it in New York. And I think that in New York, they're fearful of parents really delving into that because more parents are going to pull back. I don't know how much you heard, Clayton, but we were saying this strong fear that when they go back to the physical learning place, that it will be those poor children, those black and brown children, that they will ask to physically go back to school. And the more affluent children will be at home doing remote learning. So this is a
It's
grave.
so true. Well, let me quickly say, and I'm gonna have to jump off because somehow or another I've got some joking around, messing with the internet. But you are so right, Carol. That's that digital divide that we see. We found out even in the pandemic, there's almost like a residential divide. There were folks that could go to a second home and get out of New York City,
Yeah,
and
you're
then
right.
there's folks that are stuck in their small little apartment. So
Mhm.
yeah, if you add on to that the mental illness that comes with this, right? So you're going to have kids forced to go to a classroom and have 50% of their mind going to be, am I going to get sick? That's a problem. So we got to make sure that we are helping in a way, help the school system, help the superintendents, or whatever, to figure out how to make this a lot more easier on the students. Let me quickly say one thing, and then I'm going to get off, which is, when you look at where we are with this pandemic, one of the things that we don't talk enough about that I'm very clear on is that we did not have a plan. Some may say, well, maybe Barack Obama had a plan or whatever the case may be, but for whatever reason in 2020, we did not have a plan for this pandemic. So it's not necessarily whether you had some sort of existing condition. That's always been the case.
Mhm.
Mhm.
The issue was, were we prepared?
Mhm.
And if you look at China, which in a lot of ways was the original epicenter of the coronavirus, lost 100,000 people in no time, whereas Taiwan, right, which is 60 miles or so from China, only lost 7 people. You got to ask yourself why. And the answer was they had prepared. They actually did a prepared document after the SARS pandemic, which devastated Taiwan. They were very much devastated by that. So they put together an emergency, like a Harlem emergency network. They put a Taiwan emergency plan together
Mhm.
that was filled with things to deal with a pandemic, especially a virus. And
Mhm.
they, year after year, nothing ever happened. And they were almost like sad that they put so much money into building this plan. But when the pandemic hit, they were like, yo, dust that thing off. Let's go see what we got to
Right.
do. They closed down their airports. They had masks on. They had all the sanitation stuff going on. Did the quarantine early in March before anybody was even dealing with this stuff. And 7 deaths. I mean, versus hundreds of thousands in other places. So I hope that Harlem Emergency Network pushes for us to have a plan. These
Mhm.
disasters are going to keep coming, people. We're
Mhm.
going to continue to have the Hurricane Sandys. We're going to have the pandemics. We need a plan. We have enough information now from this pandemic to put together a plan. So maybe Harlem Emergency Network, even if it's just for our community, I mean, let's
Well,
put a plan together and be
right
ready.
right now, our overriding message and focus is, what is your plan for a potential second wave here? Because that is the most compelling scenario. It's obviously a realistic scenario. New York has no borders that is protecting us from anybody coming from Florida, Arizona, Texas, any of these places, and you can have people fill out forms when they come in on the plane, but people lie, and people drive, and people can fly into Philadelphia and take the train in, and there's no there. It's just simply impossible to build a wall around New York and keep other people out of it. So we have to have a plan for, okay, so what if it comes back? And this is definitely the questions we're asking around the school plan, which is right now, I think, the number one situation affecting us all is going to be the movement or lack of movement of kids in the fall, and how does that create new risk for reoccurrence of the virus.
Well,
So
let's work together on this. Listen, let's work together on this.
yeah.
I think it's going to have to come from the community. We can't wait for somebody to help us or give us a plan. We gotta use our own intelligence in the community to basically put this emergency plan together. I'm 100% down with it.
Hmm.
And I know Carol is, and you, and the rest of your team, my team, and others will want to have something to say, because we know this community better than anyone. So we
Hmm.
know where people need to go. We know where people are going to be most vulnerable. We know Harlem Hospital. We know all these places. We got three
Hmm.
top hospitals in Harlem. Maybe more, but at least three: Mount Sinai, Harlem Hospital, and Columbia Presbyterian. Hot
Hmm.
dog, we can save ourselves. I have
Hmm.
to go, Bob, so I'm
Okay,
so sorry, but I've been just so excited to be part of Harlem Emergency Network. I'm
great.
so honored to be interviewed by you and Carol, and
Yeah,
let's keep this going. I'm at your disposal anytime you want.
right.
Thank you
Okay.
so much for joining us.
Yeah, yeah.
Stay
So
well.
Thank you.
join us all again next week, same time, 9:30 on Facebook and YouTube. Thanks for joining us, Clayton, and we will see you all later.